Hello everyone, my name is Nechelle Wall and I'm a paramedic practice leader with the Department of Clinical Governance and Professional Practice, and I'm here today with your April 2023 practice update video. Before I start though, I'd like to take a moment to acknowledge that I'm coming to you today from the traditional and unceded territories of the Coast Salish peoples, specifically the Squamish, Musqueam, and Tsleil-Waututh nations. On to our practice updates. Since the initial rollout of the LP15 monitors for PCPs, we have received some valuable feedback from crews on areas to improve both workflow and user friendliness. As such, representatives from learning, professional practice, clinical operations, and frontline PCPs have been able to meet with the Stryker team to test these changes in a series of simulated calls and develop a plan to implement them in the near future. Here's a summary of the changes you can expect to see coming shortly. First, you'll notice that we are removing the VF and VT alarm, as this was a major concern for paramedics when it would falsely sound when the patient or the vehicle moved. Next, you'll notice that we've added the feature called motion detection. When on, this function will alert paramedics if there is excessive motion detected when acquiring a 12 ECG. Another change will be the metronome rate. So the default metronome rate for the LP15 will now be set at 30 and 2 without endotracheal intubation. So it will read 30 and 2 without ETT, and that will be the default. However, that can be changed in the field if required. You'll also notice that there's going to be a change to the manual mode for defibrillation. So it's going to be set now to a sequence of 360, 360, and 360 joules. This aligns with our CPGs as well as AHA, and it will be applicable to both the AEDs and the LP15s. Having said that, ACPs who are using the LP15s can still override this and manually select the joules that they require for their patient care. Another change will be to the event list. So when you go into the event list on your LP15 to enter in either your drugs or your procedures, you're going to notice that they will be in alphabetical order. You'll also notice that intubation has been removed and now changed to advanced airway, and this is really allowing for just a different kind of data collection so we can collect both the supraglottic and the intubations within that feature. Another feature that's being added is called the change to clock feature. With this feature, the clock is now synced with LifeNet and provides elapsed time to aid in time delivery of medications and procedures. This will also allow you to see the overall duration of a cardiac arrest you're working, for example. And last but not least, when it comes to the LP15s, we are asking now that you change your pad placement to anterior and lateral. Although previous instruction was given that it should be anterior and posterior when looking at the STEMI cohort, Stryker does recommend anterior lateral placement when using the LP15 in AED mode for accurate detection of ventricular fibrillation. As such, we ask that you now start placing your pads anteriorly and laterally compared to anterior and posterior, and we ask that this change be made immediately to your practice. Moving on to substance use. I'm excited to report that the substance use ASTaR pathway is now the most utilized pathway in the province. So thank you to all the paramedics who have incorporated the substance use referral pathway into their practice. As we know, patients who suffer from out-of-hospital drug poisoning and do not receive care in the emergency department face significantly higher risks of short and long-term mortality. Offering these people a connection to outreach services within their community when they do not wish to be conveyed to the emergency department allows us as paramedics to play a larger role within the continuum of care and of this patient population. And in doing so, we can reduce the harm associated with drug poisoning and potentially save a life. As of April 14th, 2023, we are now moving on to our 7th year of this public health crisis related to illicit drug toxicity. If you'd like any more information on how paramedics can integrate a harm reduction approach into their care of these patients, please reach out to clinical practice at bchs.ca. We'd love to hear from you, and we're always happy to have a conversation. And closing out the month of April, we would just like to give you a reminder about our urgent and primary care centers. With the successful onboarding of the UPCC partners in Houston, it seems like the perfect time to remind everybody about the alternative destinations in Prince George and throughout the province. If you'd like further information about these, please look at the BCEHS handbook where you can find all of our ASTaR and alternative destination pathways. Thank you.